Thank you for attending our next health equity workshop in our series. Tonight, we have a special focus on barriers to care among persons with disabilities and a special focus within that group on persons who are deaf or hard of hearing. Thank you to our interpreters for the deaf who are providing us with wonderful ASL interpretation. That is Miss Katie Edwards and Julie Trice. Without them this evening, we would not be able to have this open and candid discussion. My name is Amber Prater, and I'll be hosting for this evening. This event is being presented by the Health Equity Committee of Healthcare for All Ohioans, a nonpartisan nonprofit group of volunteers seeking healthcare for all people in Ohio. We're advocating for policy changes that would be inclusive of all Ohioans and cover all healthcare, including vision, dental, and preventative care with no cost at the door. Before we dive too far into this evening, I wanted to share our website so that after the event, you might be, if you're interested in getting more involved with our organization, you would be able to explore those opportunities. We are excited to have Dr. Amanda Hinson-Henslin with us today, an assistant professor in the Department of Population and Public Health Sciences. I see her waving her hand. She will start a dialogue for us about barriers to care and is accompanied by a panel of persons who are deaf or hard of hearing and who are here to share their personal stories with us as well. If you have questions at any point, please feel free to put them in the chat and recognize that they'll be addressed by Dr. Hinson after she's opened up the floor for questions. We'll also have a couple of chat monitors trying to keep track of the flow of the questions. And you could also alternatively raise your hand using the reactions raise hand button at the bottom of your screen. We also invite you to include your pronouns after your name, as you can see in after my name here, so that we can be more inclusive in this environment. So without further ado, let's get started. So as I said, Dr. Hinson is a professor at Wright State teaching undergraduate and graduate courses in epidemiology, health promotion, health education, and health program planning. She's a member of the American Public Health Association's Public Health Education and Health Promotion section and the Disability section. She is the chair of the Advocacy Subcommittee for Public Health Education and Health Promotion section, and a member of the Membership Engagement and Professional Development subcommittees. She's a member of Wright State's Digital Accessibility Committee, and her research focuses on identifying and addressing health disparities among individuals with disability through health promotion programs. And so please welcome Dr. Hinson-Henslin, and I will hand it over to her.
Hi, everyone. Thank you for attending tonight. I have some lovely people that I work with attending with me, and when asked about to be part of this workshop, I decided to bring in individuals who actually experience these barriers rather than myself, because I believe that as an advocate, I believe that they have a voice and I want them to share what they experience rather than myself. I'm just here to help progress things along. I do not want to own the spotlight at all, but I do want to share share what my colleagues have to say and their experiences. And I actually work with Darren and Annie on projects, as well as Kathy Taylor, who's also in the audience. And we actually have more projects incoming, which are going to be great, that help dispel these health disparities among individuals, not only who are deaf, but also who have sensory disabilities. This is a panel of questions, and which they were provided ahead of time so that they could prepare responses. And first, what we're going to do is have them introduce themselves. So if you wouldn't mind, please introduce your name, your pronouns. By the way, mine are she, hers, and your job title, and a little bit about yourself so that we can kind of get to know what's going on. So Darren, Annie, or Becky, please feel free to start.
Okay, I'll start. Hey, everybody. I'll go ahead and start. Hey, guys, it's me. My name is Darren Emmons, and I am deaf. And I currently am the owner of an interpreting agency. I am actually a co-owner, and we provide communication services and access to interpreting sign language. My background now actually is in social work, and I provide that, and I've been active in the deaf community. Typically, we focus on youth pre prevention advocacy for like drug and alcohol rehab, tobacco use, um, identifying like, okay, so who I am. I am proud to be deaf. Also, I am involved in the CODA camp, and that is children or kids of deaf adults. And I'm really, really involved in that. And we provide that camp every summer. Different age groups, different organizations that we can get involved in that and in different businesses. The DCRC, which stands for the Deaf Community Resource Center. I am on that board as well. And that's about who I am. I'll go. Becky, you go, Darren says. Well, hello. My name is Becky Kraft. And this is my sign name. It is a B from my forehead to my chest. And I use the pronouns she and her. I do work for the Interpreters of the Deaf interpreting agency. And Darren is my boss. I am an accountant manager here. I'm also a deaf interpreter. I have been involved in the deaf community. I am definitely a leader in the deaf community here. I am also on the DCRC board. I'm involved in different organizations here in the area. I'm a wife, a mother, a sister, a grandmother, and I think that's about it. All right, and hello everybody. My name is Annie Welch. And let's see, who am I? Oh, how long do we have? Okay, I will try and keep it short and sweet. I am really involved in so many different things. So right now I am a part-time adjunct instructor for Northern Kentucky, in a full-time instructor for Northern Kentucky. But I'm just so proud in establishing like the deaf program there and making sure that that is really successful for those who want to learn sign language. I'm also a DI there. I'm working on the deaf and blind and program there, trying to get that established. I'm also involved in the Kentucky State Department of Mental Health, their advisory board down there. There's a few projects that we've just started implementing, and so right now I'm just teaching. However, prior to that, I don't want to say just teaching because that is very important, but I was really involved in the mental health sector for years. And that encompassed a lot of my time. And I was at Wright State, and I was involved in a lot of research projects there. And that used up a lot of my time. So I'm also a soccer mom, guys. I've got two hearing children, and they are soccer gurus. I'm also involved in the CODA camp. I love the CODA camp. I think that's about it. So I'm so happy to be here. And also my pronouns are she and her.
Thank you for sharing. So our next question pertains to what are some barriers that you experienced that prevented adequate access to healthcare early in your life?
So what was the question again? Would you mind asking that question again?
So the question is, what are some barriers that you experienced that prevented adequate access to healthcare early in your life?
Early in your life. Okay. Annie? Okay. So I remember, so I was born in the 90s. Hmm. So my life is like from the 90s. So my life really growing up before that, it really meant like my access to healthcare, it was really limited. We didn't really have interpreters available. Didn't have like rights to interpreters. The communication was really with doctors and nurses, just really very depending on the doctors and nurses. It was really limited. And I grew up really having my mom interpret. So my mom really was the interpreter for me also. Like that was her role. So with my family members, having them be an interpreter as well, it was, uncomfortable sometimes. Um, it wasn't bad growing up that way, you know. But when I became a teenager, yeah, definitely not comfortable. But that was just my experience. So, Darren, Becky, this is Darren. Annie really like her comments really matched my own experience. So really, communication for me, communication access growing up when I was young. To let you know, I was raised oral. I didn't really sign. So my language skills weren't really expressive. I wasn't able to express myself that way until I was about 7 or 8. It didn't matter who was talking or signing, talking. I wasn't able to express myself. So my communication was very limited. So with doctors and medical appointments, audiologist appointments, really any of those things, that communication wasn't really there. It just sort of felt like moving pictures in front of my face. So when I became older, I started to lip read, but it was really limited. The signing was limited as well. The conversations were really limited. So like in a hospital, if people would come up to discuss things with me, that was full conversations, really there was nothing. I was really dependent on my mom. So my mom would like get, hey, one moment, and then she'd have conversation with the doctor. Um, and then she would explain things to me, but it was very brief. It wasn't the full context of the conversation. So she would have these conversations and give me little tidbits of the conversation. I constantly got that one moment, one moment, one moment. That full um, message was never conveyed. So now that with interpreters and the advent of interpreters and this industry, it's really changed. So when I was younger, that barrier was very severe, and really the communication for me wasn't there. I didn't have it. Okay, so that was my experience. So for me, Becky says for me, it was pretty much the same as Darren and Annie. I mean, I'm going to echo a lot of what they said. It was really the same. I grew up oral as well, um, and I could lip read well. So communicating with doctors was so. It was pretty good, but it was, basic for me. So like if they would say something, when I was a young teenager, the doctor would ask a question and I would sort of like not be very comfortable with my mother there. My mother was the person who was interpreting for me as well. So, uh, it really, when I was young, it really impacted my young life. So I would constantly say no to the doctor and maybe lie and not tell him the truth. And because access was so hard. So, after 1990, the ADA passed, man, it was like more freedom. It was so much more freedom. I didn't have to depend on anybody anymore. It was so nice to not have that barrier there anymore. Annie has a comment. She's saying, I want to add, I want to add to Becky's comment. Really, she's absolutely right. I remember when I was in high school, in 1990, it passed, and I was in high school at the time, and I remember, it was like the door had just opened up. My mom had the same, she was very encouraging. She was trying to make sure that I was,
knew my rights and asked for an interpreter and asked the doctor when I made a doctor's appointment to make sure that I had that access and let them know that I needed an interpreter. Um, but guess what? They dropped me as a patient. Becky's saying that's right. They dropped me. They dropped me as a patient, and it was very awkward and uncomfortable having to figure out how to figure that out. So, really, I had to file a complaint with the office and you know, I'd go after the office to try to have that right respected. So, really it was all about educating them as well. That was in 1990. The ADA was brand new at the time. It was established and passed and everything was great. No, that's not really what happened. It really, it took a while for that law to get really put into action, and we had to fight for it. We had to protect ourselves and protect our community and really explain what it meant and what it would do in the doctor's office. So, um, of with the culture and classes and everything with the community itself and colleges, they're really starting to understand. With all the new education, we're really starting to understand what's going on. Unfortunately, we had to go through that, but it really was a fight to get that. Becky's also saying it's still weak. All those laws are still weak. It's not clear. It's not clear yet. It's still not clear. And Annie's saying, I absolutely agree.
Thank you for sharing. So there's a question in the chat, and it's from Eliza, and it says, did you attempt handwritten notes to communicate when you were younger?
Yes, Becky says. So Darren says, yeah, you can try to write back and forth. It was just still limited. It wasn't full access. So, but compared to now, like, with my English and my writing skills are really much more advanced than they were. But back then when I was young, I struggled. I really struggled. I really didn't have a language. Nothing was really established. So, and my English wasn't strong enough for me to write. It was weak, and my signs were weak. So I just was sort of like stuck fumbling around trying to figure out how to communicate. So writing wasn't really an option. It wasn't clear. The understanding would still have not been there. Of course, they could have written to me, but like I don't think I would have understood their messages, all those big words and everything that I didn't understand. So yeah, writing was not really an option. And Annie is saying plus, 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 plus. I mean, maybe it's true or not true. I don't know. I'm not sure, but I've heard some murmuring is around. But with doctors, with their writing, it's just poor. Like it is piss poor. Yeah, it feels like garbled gook on there. You can't really read their writing anyway, says Becky. Um, Annie said, in this group, we're not, not doctors in this group, but in general, doctors. Don't want to pick on any doctors in this group.
Thank you for sharing. Yeah, written communication is not always accessible for individuals who are deaf and use American Sign Language, because American Sign Language is their primary language and what they usually learn first. So thank you for sharing that information.
Yes, absolutely. You're right.
So
Darren
and so now we're going to talk about what barriers do you experience currently that prevent adequate access to health care?
Darren has his hand up. He said, "Oh, I've got some comments," and no, I'm just teasing. But for me, so I need access to communication with a doctor. Also, I have children, and when they were growing up, now they're older, but when they were children and they needed, they needed doctor's appointments, I needed access to their communication with their doctors as well. So really, there's been a lot of barriers moving forward with that. So typically, it's just like, it's just frustrating, trying to search if we're searching for a new doctor, or a new dentist, or a new whatever. If it's our first time appointment, if we make that appointment, do need to let them know, like, hey, I need an interpreter. And typically they say, oh, no, you can bring your mother, or you can bring your family member, or you can, do one of those things. And it's just frustrating to have to explain that over and over and over and over again. And now with my doctor, it's great. We're established. They know me. I've been going there often. So, they know I needed an interpreter. That is a set routine. But with a new doctor, or if a new referral happens, then that barrier comes up again and we have to explain the whole thing again. Back from the beginning, all that education, all that teaching, all that explanation, and it's just repetitive. It's very repetitive. The second thing is, so when everything is set up and like, okay, we've got an interpreter for me, typically, I prefer to go to this, like the same agency, because they can match my me, and I can have a quality interpreter, because not all interpreters are the same. They're not the same. Really, there's a big variety of interpreters, especially when it comes to matching my signing style and knowing me and knowing how I prefer to communicate. So it can be a little bit of an irritating barrier for like a doctor to say, oh, we have a contract with one specific agency. But like if that agency, I'm sure it's fine. I'm sure the interpreters are great, but for me, I already have experience with a specific agency, but it's illegal it is against the law with HIPAA for me to explain that. So let's say that agency violated HIPAA and they're spreading information about my patient file. I don't want to use that agency. So a lot of doctors' offices have contracts where they can't use another agency. So also with all of our, it is our right. It's all of our right to pick our doctors. It's all of our right to pick our doctors. And whether we're deaf or not deaf, it shouldn't matter. We should have the ability to pick the doctor that we want to pick. So now, if my doctor's great, I need a good interpreter to represent that doctor, to represent their skill and their understanding. I need an interpreter to do that. And I needed a good interpreter to represent me, to make sure that our communication is smooth, that that interpreter represents both of us accurately, that interpreter is a good fit for me and what I need. But the problem is like that everyone sees it from that perspective. They just provide an interpreter. Like, what's the problem? There's an interpreter. It's like the philosophy of a warm body. We just send someone who can do it, who can flap their hands. I don't want someone who can just flap their hands who's a warm body. I want a quality interpreter. So that's the barrier that I experience the most now every day. So that is a very frustrating barrier that I have. And Annie is saying, yeah, Darren absolutely hit the nail right on the head. I completely agree. I'm lucky that my children grew up and their doctors in their doctor's office, and their doctor already knew deaf people, already had that experience. I was lucky. We had a nurse who knew sign language. Man, it was incredible. I was absolutely 100% lucky and comfortable. But that is not everyone else's experience. Not a lot of people have that same experience. So for example, I want to share an experience with you. So recently I had an eye surgery. I had a cataract. I had cataract surgery. I know I'm young, yes, but so anyway, so did you know that eyes are so, 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 so precious to deaf people, because we don't have any, like our hearing doesn't matter. We don't have the ability to hear. So like, who cares about our ears? But our eyes, man, they're essential. Darren's saying they're so important. But our eyes, man, I need to see it clearly. I need to see accurately. So, and the eye that I had surgery on was a little bit blurry. The other one was very clear. So it would get very tired. So I went through the process with the doctor, had the surgery. It's the same process. It just happened 2 months ago. Just happened. And it was just really like it was like having a mental health breakdown. I stood in the office and I was bawling, absolutely bawling, because they wanted to use VRI. And that is like, it stands for, let's see, video relay interpreting. They're saying video remote interpreting. Oh, Annie's saying, yep, you're right. Video remote interpreting. Thank you, Darren. Thank you. Yep. So that means that there is an interpreter available who can sign through a screen. So like an iPad or another device like that. So, and that is not successful. So you have to understand the process, I think, was about, 6 different appointments altogether, including the surgery, So most of those appointments, I had a VRI interpreter, and in that office, the signal's not good. It's not strong enough. It's very weak. And Darren's saying, so it means it glitches quite a bit. Yeah, the interpreter looked like they were a robot. Like it was hard to get a smooth message. And the doctor and nurse were frustrated, but they didn't do anything about it. Like I can advocate for myself. I can say, no, I don't want a VRI. I don't want them. They're not good. I need all these things. I need to know all of these things, but the iPad itself is over here. There's no pole. There's nothing. There's not a stand for it to be on. It's in the corner. So I'm having to communicate like this with it moving around. And it was terrible. It was terrible. It was an awful experience. And for me, do I want to go back through that experience again? Absolutely not. Absolutely not. And that's the reason why many deaf people just don't go to the doctor, or they don't take care of their health because they don't want to go through that process, that excruciatingly frustrating process. It was awful. It was an awful experience, truly. So that is the barrier that right there, that, doctors and hospitals are looking for the cheap answer. They're looking to save money, and they're not always a successful option. They're not always the option that is the best for the patient. So I'm lucky that was my last appointment. I got the surgery and I had an interpreter in person for that surgery. I had one, and I was very lucky to have that. But no, it was frustrating. Becky is saying, yeah, so I've learned a lot. Going back 8 years ago, here is what happened with me. So my husband had a bad stroke. We brought him to the ER, and the kids showed up, and my kids are grown. They're adults. But my adult kids got into the ER, and we got all in there, and we needed an interpreter. And really, they told me we couldn't have an interpreter. We had to use the screen. And I said no. This is a life or death situation with my husband, and this is for his life, and I'm not willing to risk that, and I don't want my kids to have to interpret for me. And this is a time for me to teach them, for me to go up the chain, for me to educate them and tell them what we need right now, because this is a life and death situation. I needed to focus on myself. I need to get an interpreter. Plus my kids, they're worried about their father. They're worried about their mom. Their mom is deaf. They're trying to explain things. They don't need to interpret for their mother in that situation. Imagine the emotional experience of that, how much they're going through, and having to remove our humanness and be an interpreter in that role. It is not doable. It was such a struggle to try to get an interpreter. It was so hard. So, I don't want to use the screen. I want to have short bursts with an interpreter. So it is about educating people and how to use interpreters and how to function within a hospital setting, within an ER. But they're very stubborn and strict and penny pinching, and they refused. They go back and forth and deny access that way. So that is one experience that I think that we need to change. Really, it's a tough experience. And I don't want to see other people go through the same experience as I did. I mean, it was, still today, there's some areas within a doctor's office that yeah, it has just been an awful experience for me.
I was thinking back. My ex-wife is deaf, and our three children are hearing. My youngest daughter, her name is Bella, and I don't know. I was probably about 34, 35 at the time, and there was an interpreter there. Um, but the one nurse that was present, she kept looking and she kept saying, is I, is Bella hearing? Oh, and her parents are deaf, and she just like had this look of concern, and she kept asking Bella, like, please talk for your parents. And Bella was like, okay, I know apple. And she said, well, can you say apple? And my daughter was like, I mean, her first language was ASL. I mean, she's hearing, of course, but she signed Apple. Okay, and the interpreter saw her and she voiced for my daughter. You know what I mean? And the nurse was like, no, 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 you're wrong. And she said, I want you to say Apple. And so she signed Apple. So she heard it and she understood it, but she responded in her first language, which was ASL. And we were like, well, she responded in her L1. So anyway, it's like a switch of perspectives. I mean, the nurse was asking her to do something, and Bella wasn't wrong. I mean, she was raised correctly. Uh, Her concern was different. It was our parenting skills weren't off. We were raising her correctly. But anyway, I mean, today Bella's getting ready to graduate with 2 degrees from college, and she can speak English just fine, you guys, and she signs well too. She's getting ready to be an interpreter, as a matter of fact. So, I mean, it's all in the eye of the beholder. And if I could talk to that person now, I'd be like, chill out. So it's all in the eye of the beholder again. Another thing I wanted to mention is a situation. One time I went to the emergency room. It was actually at the same hospital, and a nurse approached me. And she was like, I guess she didn't know a few things about the situation that was at hand, and she was trying to talk to me, and um, it was in regards to a blood clot. And I had read up on it, and I was speaking with my doctor. And so the nurse came up and she was commenting, and I was like, oh, okay. And I was talking back. And of course, I was doing this through an interpreter, and the interpreter was speaking like eloquently, like as on my language, as like I'm educated. And the nurse was looking at me kind of shocked and in disbelief, and her chin was on the floor, and she was like, wow, check him out. And so she went out and she was telling everybody, like, this deaf man is smart. Well, you guys got to come check him out. And so the doctor came in and he started speaking with me and such, and he was like, wow, you know all of this? And the doctor was like, you guys, it's okay. So again, it's all about perspective. I mean, you look at us as if we don't have a brain, but we just can't hear. It's our responsibility to show you all that we have the language, as long as we can show you through a qualified interpreter that we can communicate and we can express all the equivalents. We are not uneducated as long as we have a qualified interpreter. So as long as we have an interpreter that can get the message through to you and get the message from the doctor to us, what the doctor wants to give the information to us, we'll be able to get that information and completely comprehend it. But again, the main point is a qualified interpreter that can match me and that can also match the professional. And Becky is saying, now, the reason why it's important to have an interpreter here, many people are not a live interpreter versus a one on a screen. Now, at the hospital, they use, you guys call them a VRI, and at the hospital, they call them a MARDI board. You have to remember that here in the deaf community, regional signs are extremely different. So sometimes when you use the screen, or even if you use an outside interpreter, there might be some miscommunications or misunderstandings. So myself, for example, I am from Michigan, and so that's like north of here. And if we were to sign outside, we sign this sign here on our shoulder. Now, sometimes the interpreters, now if I'm just signing away, and if this is a good interpreter and they catch the content of me signing, they will understand that that means outside. But if not, they'll say this, now that means capital or captain or something like that. And I'm like, well, that doesn't even match what the sentence is. So then I have to stop them and I'm like, no, that is not what I said. And then, then it kind of gives me a little frustrated. And then it kind of makes me sound like I don't know what I'm talking about and takes my register down just a tad bit. So then that kind of gets them frustrated, and it frustrates me because it wastes my time. So then I have to back up and explain to them. So it's really important to have a live interpreter because that can be explained quickly and just right there on the spot. So live interpreters are really important to have in person and versus on a board. It just makes everything go more smooth. Live interpreters are just better to have. You can save money. I mean, I know big entities like the hospitals want to save money, but in the long run, it's just better to have a live interpreter. And Darren said, okay, did you hear what I mentioned earlier about the doctors, about the hospitals and whatnot? And he says, yeah, tell them again. Well, Darren says, well, I was talking about, I mean, interpreters are great. I love the interpreters, but interpreters go two ways. You have to remember that our access must match the equivalent of the professional as well. And many times, like for me, when I call for an important appointment, and I'm using the specific agency, they'll say, oh, well, we don't use that agency. We use this one. And I'm like, well, I'm asking you, how do you know that they will provide qualified interpreters? How do you know that? Have you assessed their skills? Are you knowledgeable of what they what the kind of interpreters they provide? And they say, well, no, sir, but we do have a contract with them. And I said, but how do you know who the best interpreter to match me and my personality and my level of signing will be? So those are the kinds of questions that I like to ask when I'm calling to set up an interpreter for my appointments. But some deaf don't know that they can request and that for specific interpreters or specific agencies. And that is their right to have a qualified interpreter and even one that they would prefer to be there in the appointment for them. Don't just send a warm body. That's so rude.
Thanks for those details. Oh, sorry.
Yeah. So I don't want to, Darren saying, I don't want a warm body. I want a qualified, and I don't want a warm doctor either. I want a good qualified doctor, and I want a good qualified interpreter. I need somebody who can communicate all the above.
Thanks, Darren, Annie, and Becky. So the next question is actually up in the chat. It's from Lorna, and she says, do you have difficulties now with finding doctors and specialists who will provide interpreters and services for the interpreters?
Could you say that again? Darren as asking, can you say that again?
Do you have difficulty finding doctors or specialists who provide interpreters?
Annie is saying, well, right now, the current doctor that I have, I really like this one. Now, the first time that I met the doctor, I was like, okay, because they didn't provide an interpreter. But I knew that after a while, after I developed a rapport with this doctor, and we became a little bit like establish a relationship. Oh, then they kind of figured out that they needed to provide an interpreter for me, and not a remote interpreter. We didn't even mess around with that one. They provided a live interpreter, and I was very grateful for that. However, I do want to let you all know that the interpreter, well, was qualified. However, we don't have enough. Now, again, I live in Northern Kentucky. And in Kentucky, the law there is a little different from the law in Ohio. So if you work in Kentucky, you must have a license through the state of Kentucky. It is required. Now, if you don't have a license through the state of Kentucky, you can work to up to, I believe it's like 20 or 21 days per calendar year. Now that's kind of tough because in Northern Kentucky, a lot of the interpreters typically work in Ohio. So like Darren was mentioning before, I prefer qualified interpreters, and we are extremely picky. We love to pick what interpreters we prefer, and I have one. And if that one interpreter who's a coda, who's extremely qualified, if that person isn't available, then what do? Then I am like looking around, scrounging for an interpreter that is qualified who can interpret for that appointment. So that is a barrier right now that I'm experiencing in my area of Kentucky. And then Darren says, if you don't mind, let me piggyback on that, Annie, just for a second. In Kentucky, what Annie just mentioned, they must have a license to work in the state of Kentucky. And the law there is standard, not just for Kentucky, but in other states as well. Now, here in Ohio, there are no standards. There are no rules, no license. Like it's almost like anybody. If you got hands that you can flap around and pretend that you know sign language, you can do it. And Annie is saying, yes, registered interpreters for the deaf should have something that is a standard that you should have. Absolutely. Yep. And Mandy is wanting to say something.
So one of the questions was asked is, do you ever feel that the interpreter is not adequately portraying what you are saying?
Yeah. Yeah, 250%. And Annie is saying, I get so nervous at times. I mean to tell you. Darren, go ahead. Annie's saying, Darren, go ahead. And Darren says, so the interpreter training programs here in Ohio, I mean, they're good programs. They get the interpreters through, and then once they're done and they graduate, that doesn't always mean that they're qualified. They need to go out into the real world. They need to get experience. They need to figure out what kind of style they do. They need to get speed. They need to get different exposures to different deaf people, just different experiences of voicing, improve their receptive skills and whatnot. So there are a lot of good qualified interpreters, a lot of good interpreters that are willing to develop their skills as well. However, we always need more interpreters that are better and qualified. Like in rural small towns, it's really hard to find good qualified interpreters. Like if someone is called into the ER in a small country town, now in the bigger cities, like here in Dayton in the ER, it's not really a challenge to find a qualified interpreter. Now, if you go to a smaller city, then of course it will be harder because you might have fewer interpreters there. So I would say yes. I don't know how to resolve that issue, but it's going to always be a challenge. Yeah, there's always going to be a barrier when it comes to that. And that's always something that we're always trying to improve on. And I think that it's partly because not so many interpreters live out in the rural areas, and maybe the same thing as deaf people. They prefer to live closer to the city as well. And Annie wants to add. And Darren had mentioned about the ITPs, which stand for Interpreter Training Programs. When I mentioned earlier that I get extremely nervous, it's because I teach at an ITP here in Cincinnati. So with me being a part of that and me seeing the students once they graduate, they could possibly one day be my interpreter. So I'm training them up as if one day they're going to be interpreting for me. So it's what if they're in my appointment one day? I need to have them I need to have them be ready to be on the other side and not be my student, but be my professional. So I need to make sure that their personality matches, that their skills are ready, that they're ready all around. So I just try and feed into them as much as possible in the time that I have them in the ITP. So I have to really think about what I want to provide for them when they're in the school. And Darren is saying, yes, for people of color and for BIPOCs and for and male interpreters, those are the ones that we really need to get into the ITPs. We don't have enough of those to pick from. Qualified male interpreters, I need to add.
We have another question from the audience from Jose. As the years have gone on, have you found that medical care providers are advocating for their patients for accurate, experienced interpreters more, less, or the same? I guess in comparison to the past.
Annie says, well, it kind of just depends on the situation. Sometimes I feel like they're right on top of things, and then sometimes I feel like nothing happens. For example, when I was explaining about my eye situation, the ophthalmologist said that day was like, it seemed like the appointment was a little a wash. I arrived, and that's when I just broke down emotionally, and I was really frustrated, like already with the eye situation.
So that was my fifth doctor's appointment for my eyes. And it really is when I had the breakdown because like I'm a very strong person. I am I am not a weak person, but that day I was so frustrated. This is my eyes. And the nurse there, she saw what had happened. And she took over and she said, "No, I'm going to take care of it. I'm going to take care of you." Um, and she became my nurse. She said, "I'm going to become your nurse for all of this, for everything, for all of your required appointments." She knows some sign, not a lot. She wasn't able to go very in depth, but she took over and she was able to have the iPad. With it glitching and everything, it wasn't clear. It was worth nothing, So she put everything down. She wrote everything down, everything that happened, how many times the video froze. We're not blaming the interpreter. That's not the interpreter's fault. It's the signal strength. It's the Wi-Fi. It's weak. It was weak. It wasn't enough. So the nurse put everything down. She recorded everything in that appointment. And then she brought it to the office manager and she showed them. And she said, "This is what I'm seeing, you know, and she's trying to advocate for deaf needs. And I'm hoping that makes a difference from here on out. That was my last appointment. At my last appointment, I did have an in-person interpreter. So I'm hopeful that advocacy made a difference. Becky, do you have anything to say? Is what Darren is asking, and Darren saying, yeah, I've got the same idea that, you know, that advocacy idea of like, I had a time where I had an appointment and really, with my interpreter, you know, sometimes the interpreter will be specific, be picky. I am picky about my interpreters. I need them to be specific, so that I can have access at the same level as my speaking voice, as the education that I have. I don't want someone to dumb me down. I don't want someone to make me sound different. I want it to be equal and equivalent. So for that appointment, I need an interpreter. I need a specific interpreter from a specific agency. And they said, "Oh, sorry. We don't do that." And I said, "I'm sorry. You don't have preferences that way." And I said, "I'm going to go ahead and go to another office, to another office manager. I'm going to go up the chain because and I explained everything. I'm not doing it this way." And many times they'll call back and if I say that I'm going to cancel the appointment, then they're going to accept it. But you have to go through it. I still have to go through it. I still have to have that experience. It's still a struggle to go through all of it, all these problems. It should be over with by now. It should be done with by now, but it's still a struggle. And Darren is saying, for like the medical arena, it has improved. Advocacy has improved. Knowledge has improved. The understanding of the deaf community has improved. It's all improved. But what I've noticed is when people come up to me with their experiences and we talk about that, we can learn from each other, and then we can become partners and allies. We can work together. We can support each other. We can advocate for each other that way. I don't know if that's improving everything now. It just depends on your situation, but I think that that's a good option for moving forward. And, something that Becky said, and Annie, I agree with what you say. Maybe I can get my 2 cents in here, but many times for deaf, when they go to maybe the ER or a medical appointment, they've already had a traumatic experience from going to the ER or going to the doctor. And the first thing they think of is that experience, that traumatizing experience. How will I communicate? How will I get my point across? So if they go to the ER again for, like, let's say a broken leg, but they're traumatized, then that's going to make communication worse. It's like twice as bad. It's like two barriers on top of each other. And how do you manage that? So that's something that all of us, that the traumatic experience, we've already experienced that trauma is innate with us. Give the interpreter one moment. A psychologist. Like, let's say I went to a psychologist, and give the interpreter one moment. Darren's going to spell it out. Psychiatrist. Thank you. Excuse the interpreter's error. So I went to the psychiatrist. And really, for me, I'm a social worker. That is my, connection to that psychiatrist. So, and they believe that all deaf people have PTSD, post-traumatic stress disorder, from the start of their life. That is their experience. I thought that was really interesting. Like, that means that as a deaf person, I grew up, from being a little kid, I grew up with that trauma, the traumatic communication experiences, going to the ER, falling down, having people come into my face, not understanding. I'm already traumatized from that lack of communication. I thought that was a really interesting perspective. So, and Becky, Annie's saying, yeah, I absolutely agree. So just maybe it doesn't answer your question. It's a little bit off the point, but So more, I think it's more possible to improve. I think improvement is possible now for like, I teach at Northern Kentucky University, and there's a few students that come to me and they say, I really enjoy learning ASL. I really enjoy your classes, deaf culture, deaf heart. I really, want to become a medical major in medicine. I want to major in the medical field, and I want to improve like their knowledge and their understanding. They're just students, they're just going through like pre-med programs or nursing programs, but they really have expressed like it's, you know, rough to have the training, and what they're experiencing and what they're studying is just a rough experience for all of us. So having the understanding of deaf people and deaf culture in the medical industry and in the medical field, and being able to communicate with a deaf patient, man, that could definitely improve things as we move forward. Absolutely. And Darren is saying, yeah, I know we've been discussing the medical field, but I really think it's important to also mention mental health. And he's saying, absolutely, I agree. And Darren's saying, it's not improving. It's regressing. It's plummeting. Before it was improving, but now it's not doing that. It's going in the opposite direction. And he's saying, yep, the state government, thank you for all of us regressing. There's not enough money, not enough spending. So a lot of people have lost their jobs in mental health, but the state governments have decided to cut spending and cut funding. So really, everything is changing again. That's why we need to focus on ASL and educating, and that way, things will improve again in the community. And Darren saying like, for development, in the like workforce development, like for social work and deaf, and the deaf community and things like that, really all of that spending has been cut. There's nothing, and it really has gone downhill because of those cuts. And for Annie is saying, I think we had maybe two active therapists, like who focus on mental health in the state of Ohio, maybe two. I think just two I think maybe they're ready to retire, but that's it. That's all we have. It can't be more than three. There's no way. And it's really, really sad.
So we have another question in the chat. And this is from Nancy. And it says, can the speakers address how the experience of the deaf community can be generalized for people with other disabilities in accessing healthcare and the understanding of healthcare providers?
To be honest, I don't understand the question.
Nancy, would you please rephrase the question maybe?
Well, I'm just interested in thinking, can I, just speak it out. It's easier for me. Just interested in thinking about how, well, people with other disabilities, say somebody who is paraplegic or something, I guess I'm thinking the healthcare providers won't necessarily understand their experience and their position. And so that might be one aspect of accessing healthcare and accessing the feeling that you're actually getting the kind of attention that you need. And the other point is that everybody's brought up already advocating for yourself. So that would be a parallel.
Annie is saying, so I could answer that best, I think. So please keep asking me questions and ask me for clarification if you need it. But so for deaf people, our experiences of being frustrated, of feeling oppressed, and all of the things that we've discussed, and the people with other disabilities, I think their experience is really similar. It's the same kind of experience. It's a little bit different, just a little bit, because their priority is not language. They speak English. It's fine. They can speak English. They can access English. That's the big difference. We're deaf. the language is the problem there. It is different. It is ASL. So that communication is crucial. It is the crux of our experience difference. But I do want you to understand that the frustrating feeling, the oppressive feeling, it's absolutely connected. Absolutely. But it's a different level, if that makes sense. Does that answer your question, Nancy? Darren,
Yes, thank you. That's part of the answer.
So Becky is saying that language was like ripped from us at a young age. Like that language, it's been deprived. We've been deprived of it at a really, really young age. Plus, you have to remember that for deaf people, we can't hear, we can't access that language another way. So for other people with disabilities, they can pick up language. You know, deaf people have to be taught. There's no incidental learning that way. So that happens from a young age. So some parents, don't know how to teach their kids that way, with that expressive way, that visual language, with that visual language. And that's the problem. We're deprived of language if we don't have access to it. And that's the biggest difference. So Annie is saying what Becky said was great. 96% of deaf children are born to hearing parents. And only about 75% of those parents, 75% of those parents do not know sign language. That is the problem.
So I know we're reaching. Oh, go ahead, Darren.
Darren's saying another perspective is we've talked about language over and over again, and it's not, just focusing on the, it's not focusing on that. It's not that. It's more it's more of the language. It's not autism in that way. It's more focusing on the language. So like a person who speaks Spanish, for example, if they see a doctor and they speak in English, that's a barrier. They can't communicate. Does that mean that Spanish speaking person is disabled? No, it doesn't. It's the language barrier. That's what's happening there. And I feel like that's what's happening with us. We're signing and they don't understand sign language, so there's a barrier. We need an interpreter. We need an interpreter for communication for both situations, for both the doctor, for both the Spanish speaker and an ASL, but for both the doctor and for the deaf person. It's not only deaf, it's people who sign are only for deaf people. It's for all of us to feel connected, for those of us who know sign language and don't. And then Annie is saying something that's nice about speaking Spanish, or people who need Spanish translators. There's an app on your phone that you can use. I can talk into my phone and it can communicate for me with no problem. There's no ability for that for ASL. Darren's saying soon, and Annie's saying we'll see. And Becky's saying, and you have to remember that there's different levels of deaf people. Their languages are different. Their level of language is different. So not everyone's like me. Not everyone's like Darren. Not everyone's like Annie. Everyone is different. There's different levels for language accessibility as well. Andy is saying yes.
So I'm going to try and summarize our other questions into one question, and that'll help the panelists out a lot. So if you could make recommendations to healthcare systems and or policymakers that would remove barriers for your access to care, what would that be?
So Darren's saying, yeah, for me, I always say, I say it over and over again. I comment about this a lot. But they both need to have a discussion. Like there needs to be some middle ground. There needs to be some understanding for communication. Like, so if I called and made an appointment and said, hey, I'm deaf and I need an interpreter, I would prefer all of these things that I prefer, and they accept it, there needs to be more, they would need to accept it. There needs to be more understanding, more training for the medical professionals in the medical field, how to work with deaf people, not just deaf people, but deaf blind people, deaf people who sign, deaf people who don't sign, deaf people who, maybe they're hard of hearing, or, they just need more training on how to approach those different groups of people, in the deaf community. So, and not just assume, Becky's saying, yeah, for all. So, and not just assume how to communicate, but actually work to communicate. That's just, for an example, I went to a restaurant and it was a new restaurant and I asked for a menu and they gave me the Braille menu. And he's laughing. I'm not blind. I'm not blind, but I'm just saying there needs to be training. There needs to be an understanding of what it means to be deaf and what we need. And he's saying, all right, go ahead, keep going. And Darren's saying, like, for the medical field, whatever training needs to be included, like in their training, in their school, of how to work with deaf people so that they know, it needs to be in the school systems that way. And he's saying, I absolutely agree. I think the same thing. I would really love to see the training included in their annual training. I'm not sure what they call it or what they have. I know they have some kind of training that they're required, but like every year, like refreshers or whatever, or whatever new information comes out. I think that having that training about how to interact with a deaf person and the culture and all of those things, put that in the annual training every year. I think that would be really I think that is crucial.
Annie says, yeah, that's about it for me.
Becky, did you have anything?
I put something in the chat that I'll just say it, I guess. I've always wished that the schools would include sign language as a language that would be a requirement for everybody, so that people who happen to be deaf are not in a different category. I mean, so if a Spanish person is in class, you need to be able to speak some Spanish. And I think that it would be make it a mandatory thing as a requirement. I don't know what you think about it, but I think that would be a really wonderful thing. I would have loved to have learned it, sign language.
So Darren is saying, whoever's learning sign language and taking classes, like, yeah, go ahead. Yeah, bring it. Yes. You got to understand though that for ASL, learning ASL doesn't mean that you're an interpreter. Those are two different things. Communicating with deaf people and interpreting for deaf people are different things. Interpreters need training. Signing, doing basic signs, basic communication, that's great. That's awesome. That's wonderful, but they're different. And Becky is saying, yeah, I see, learning sign language in like medical school. I think that would be really great as well. Becky is saying, yeah, that, here's what my students, they really want more. They want to go more in depth with the medical training in ASL, having ASL really included in that medical training. I'm hoping that we can work on it.
Okay, so I teach ASL. This is Annie speaking. Oh my goodness. And the numbers of the students that I've had, they are taking them up and it's growing exponentially. I do believe it was last week, if I remember correctly, for the first year students, those that were taking ASL of deaf studies as their major, that they wanted to add it as their major. I noticed that already that compared to the German language, their program, it's already shut down. That's in part because they're taking ASL and those numbers are increasing. So in a sense, yeah, I kind of feel bad, but on the other hand, not so much because we have so many deaf people here in our region. And, ASL I want it to be deaf friendly here in the area. I want people to learn ASL more. I just feel like it's more beneficial. They would use it more here in the States. You know what I mean? More than German, of course. I don't disagree that German isn't a beautiful language. Don't get me wrong. I do believe that it's growing. However, I think here in our area and in our region, they'll see ASL used. So, and Darren is saying, I know that ASL 3, it ASL is the third most used language here. So I'm looking to see that as we implement that more, maybe it will be used more often. And Becky is saying, are you all aware that in Michigan, there are 2 deaf doctors at the University of Michigan? And Annie is showing her excitement. And Darren is saying, are you talking about medical doctors? And Becky is saying yes. And Annie is saying one in Texas as well, who has a full-time interpreter that accompanies him. And Becky is saying that is also the same case at U of M. And daggone it, I should have married a doctor. And Darren says, well, you had your chance.
Okay, so we're coming close on time. I wanted to see if there's any last questions from the audience members that you want to ask the panelist. If you want to come unmute, you can, or you can type it in the chat if you prefer.
I know that from the using like the VRI or Marty's in the healthcare setting, there is typically, like the opportunity to rate an interpreter from 1 to 5 with stars. And I'm just wondering if there's a mechanism for you as a user of either in-person or video interpretation to give feedback to the healthcare systems that you're in on the quality of the interpreters so that we as providers could take that feedback and improve or utilize different interpreters or different companies or whatnot.
Darren, what do you think? Annie's asking. And Becky says, I wonder if that's possible.
So as of now, there's no system in place that you've experienced?
Annie's saying no. However, we do have a system that somebody has set up somewhere where students can rate their professor. So as I'm thinking about that the other day, I was like, well, why in the world can't we have rate our interpreter? And I'm like, well, why not? And then Darren wants to throw in there. I mean, if I'm here with my business of interpreting, then I'm thinking, we've got a system set where we can schedule interpreters to match the clients and whatnot. And I see that we have emergency appointments, like where we go to the ER and send interpreters there, and all of the challenges that we encompass with that. I know sometimes clients can't be satisfied 100% of the time with the interpreters that we send to them. And the patients can't always be happy when they see a specific interpreter coming at like 2 a.m. But like we have 60 or 70 different interpreters, and maybe not all of them are available at 2 or 3 in the morning. So we send who we can. And Annie is saying, yeah, so you're kind of stuck between a rock and a hard place. And so Darren is saying we send who we can and who is available at that time. So it's kind of hard to judge the agency So we send the interpreter who can go, and not in that situation, we wouldn't say we have to send a warm body, but we have to send the interpreter who is available at the time. And we try to send the one who is the best match and who is the best able to go and interpret for that client. And if nobody is available, then we have to send the most qualified at that time.
Yeah, really, it's, agencies are the same that way. And Becky is saying for me, Baron's saying, I'm sorry, Becky, but that's why, that for those contracts, for those one agency, that's not helpful in that situation, because then we can't broaden the search. We can't, you need to be able to provide other interpreters, if a client goes to the hospital, they have to be able to use more than one agency. They can't be stuck with one agency. So Becky's saying, yeah, for when they go to the hospital, when they use Marty for specific appointments, Marty doesn't use, it's for foreign languages. It's a foreign language service. It's not focused on sign language. That's an agency that provides foreign languages, like other spoken languages. So, they have interpreters that haven't yet experienced this type of environment. So it's really sad. So for me, what Darren mentioned with the ER and an overnight experience, like midnight or, and later, it is really tough to find people at 2 o'clock in the morning. But in that case, I don't mind using a Marty. You have to understand though, if it works, because like 98% of the time, in my experience, it never works. It's glitchy. It doesn't pull up a picture, and I'm just stuck. And it really is sad. And Annie's saying it really, like the signal, man, the services. I don't know if it's the signal. I don't know what it is, but it's bad. Yeah, Becky's agreeing. Yeah, it's bad. And Darren's saying, yeah, for the screen, I think it could be good if it was used right. Maybe like 2 o'clock in the morning, if you're desperate to find an interpreter, for a temporary fix, for a temporary period, before an in-person interpreter can come. But many times they don't do that. They don't provide it that way. With the screen, they say that's it. And that's just really not, they're not flexible in that way. And Becky is saying sometimes with the screen, you're like 2 o'clock in the morning, they don't know how to use it. There's no IT person who's working at 2 o'clock in the morning to come troubleshoot it and get it up and running. So it's frustrating for them too. And Darren's saying, maybe they should, God bless all of us for figuring it out. And Annie's saying, it's 2 in the morning at a hospital, okay? And Darren's saying from midnight to 6 a.m., don't get sick, just stay home, okay? You stay under the covers, and then at 6 o'clock, you rush to the doctor, because there ain't nobody between those hours.
I'm curious, in the training of interpreters, are there like two different, what do you say, different channels? Like some would be experts more in medical interpreting, and others might be experts more in other kind of interpreting.
Annie, you had a comment to Darren? Yeah. Annie's saying, yeah. So we have different treks, like for ITPs and their programs. We have different like classes that they could focus on. Medical interpreting, legal interpreting, educational interpreting. Also, we have like program like Alabama. There's another state, like the state of Alabama. They have mental health interpreting, and man, they go in depth with that training. Truly, I have seen interpreters that will fly to Alabama to take the classes there to train in that mental health specialization, and we really need that. And Darren's saying deafblind. We have a deafblind track or deafblind specializations. There's interpreters there who want to train in Washington State, and in other states for that as well.
All right. Well, I'm going to say let's be respectful to everyone's time, because I see some people hopping off. Thank you, everyone who attended. Thank you for your questions. Thank you for the panelists. I'm so thankful that you came and shared your experiences. So grateful for all of you. So have a good evening. Unless Amber, is there anything else we need to do?
I would just drop in the chat here a feedback link. We have a survey to provide feedback for our events. We always try to keep our workshops more relevant, up to date, and always getting feedback of how we can improve them for everybody. I'll also include it in a follow-up email as well. So, as well. And thank you, everybody, as Dr. Hinson said, for coming and joining us this evening and for all of the insight that you provided during the conversation.